Good afternoon, everyone, and welcome to this webinar, another in the series of real talk about reopening your orchestra in the time of COVID-19. We're so thrilled that you're here today. We've had a wonderful response to this particular session, and we're extremely grateful to our expert guests today, Janet Sellery of Janet Sellery Health and Safety Advisory, as well as Christopher Millard and Meiko Lydall from the National Arts Centre Orchestra. My name is Catherine Carlton. I'm Executive Director of Orchestras Canada, Orchestras Canada, and I'm speaking to you today from Peterborough, Nogajiwanong, where my colleague Lauren Drew and I currently work and live. And I would like to acknowledge the people who have been the traditional stewards of this territory, the Mississauga Anishinaabe people, and to also acknowledge that this land is covered by Treaty 20, the Williams Treaty, and may we all, as we approach the National Day for Truth and Reconciliation, consider the meaning of inhabiting this land and honoring the traditional teachings of Indigenous peoples who've long lived on these lands. So thank you very much for all of this. As I mentioned earlier, this is another session in an ongoing series on helping orchestras cope, adapt, and move forward together on best practices for, once again, rehearsing and performing safely and well. And one of our particular preoccupations is the collaboration between musicians and management in ensuring that life on stage, in rehearsal, in performance, and someday soon, we hope, on tour, will be safe, enjoyable, and possible for musicians, guest artists, stage crew, and staff. So with no further notice, I will pass the baton to Lauren Drew to take you through some of the technical aspects of today's webinar.
Hey everybody, I'm Lauren Drew, Director of Member Services and Learning with OC. And as Catherine said, pleased to be joining from Peterborough, Nogajiwanong. A few technical notes before we get started. Please keep your video and audio muted throughout. We are recording and we'll circulate the recording to you in the weeks following this session. There will be a Q&A portion near the end of the session, so please type your questions in the chat and we'll be monitoring to ask our speakers. I will paste instructions in the chat to enable live simultaneous interpretation. We're very pleased to have Paul Stiles here. He'll be interpreting into French, and you'll see those instructions soon. We are also pleased to offer English closed captioning, and I'll also paste instructions to enable that in the chat. A recording and the resources from the session will be available in the coming weeks. So with that, I will turn it over to our wonderful speakers. Janet, if you'd like to get us started.
Excellent. Thank you, Lauren. Thank you, Catherine. Welcome, everyone. I'm Janet Sellery, and my pronouns are she and her, and I'll be your host today. I'm joining you from Stratford, Ontario, the traditional territory of the Anishinaabe, Haudenosaunee, and Ojibwe Chippewa peoples. This territory is covered by the Upper Canada Treaties, and we thank all of the generations of people who have taken care of this land. Just a little bit about me before we get started. I wish I could tell you I was a musician. Sadly, I'm not, but I am a former stage manager. I've worked primarily in theater, but also some opera, musicals, and so on. I worked for 24 seasons at the Stratford Festival, moving into health and safety after a critical injury involving an actor. I went back to school, and now I'm an occupational health and safety consultant, specializing in the arts, entertainment, and live events. I'm really passionate about this work, and I enjoy working with artists and all of the people who support the arts. I want to take a moment to acknowledge the excellent work being done by our arts service organizations throughout this pandemic, including Orchestras Canada and many other individuals and companies. So this session, Real Talk and Health and Safety Planning for the Fourth Wave, is one orchestra's experience of how to take that fire hose of information and turn it into a plan to keep music alive. So I'd like to introduce you to two members of the National Arts Centre Reopening Committee. And I'm going to start with Meiko, and then we'll go over to Chris. So Meiko, tell us a little bit about you.
Thanks, Janet. My name's Meiko Lydall. I have been the personnel manager of NACO for 8 years now. Prior to that, I was the assistant personnel manager for 4 years. And my time at the NAC goes back actually 17 years when I first started there as assistant to the music director. And in a previous life, I was a jazz trumpet player. So that's
Cool.
just a little bit about me. And I do, before Chris introduces himself, I want to mention that both Chris and I are coming to you today from Ottawa, and the NAC acknowledges that we are located on the unceded, unsurrendered territory of the Anishinaabe Algonquin Nation, whose presence here reaches back to time immemorial.
Thank you, Meiko. Let's go over to Chris. Tell us a little bit about you, Chris.
Hi, Janet. So I have been in the National Arts Centre Orchestra as a bassoonist for 18 years. And before that, I was almost 30 years with the Vancouver Symphony. So I'm in my 47th season playing Beethoven, Brahms, and Mozart, and have a very happy life to look back on.
Wow, that's impressive. So I know that for everyone listening, every orchestra is unique. So this is an opportunity for you to really hear how this process has gone and think about the lessons that you can apply to your own work. So where I want to start with you guys is to ask you, what does work look like at NACO this week? So if we were to come to play a rehearsal with you, what kinds of things would we experience?
Sure. So we just wrapped up our third work week, and our first 2 weeks involved the full orchestra concerts for a small in-person audience. And we're currently selling between around 350 to 400 seats in a 2,000 seat hall. And all of our concerts this season, or just about all of them, are going to be live streamed as well. Some of the live streams are free, and this season we are introducing a paid ticket for selected live stream concerts that we're presenting. We started off the season with 2 great concerts, and then this week we did a video recording project, which will be released as a student matinee video offering later in the winter. In terms of our current protocols, all employees entering the NAC must complete a daily COVID screening. This season, we switched over to using the generic province of Ontario employee COVID reporting link, which has been a lot easier to the system we were using last year. As well, all musicians entering the doors to Southern Hall backstage get their temperature taken upon arrival. The NAC implemented a proof of vaccination policy in late August. So all of our musicians were required to upload proof of full vaccination to the NAC before our first service in September 7th, I believe was our first day back. And I'm very happy to report that we had 100% cooperation from all of our musicians and support staff. So for me as the personnel manager, this has been extremely reassuring, and I'm very grateful that we have a fully vaccinated orchestra. And then in terms of physical layout, so we're still using the largest shell configuration available to us, and we are still maximizing distance between players on stage, so the 6 feet distancing. Currently, string players are not sharing stands, although we are looking at going back to sharing stands very soon. Ontario guidelines have relaxed, and so we've removed all of the plexiglass barriers that we had on stage. Last season, we had quite a bit, and we have none of that now in September.
That's fantastic to hear,
yeah,
Meiko.
Yeah,
you must have looked at that as a very positive change for your orchestra.
It's a very, very positive change. It's
okay.
a wonderful move in the right direction. And there's also no requirement for barriers between the stage and the audience. So that's been helpful as well.
Can you tell us a little bit about where you are with masks? What's the mask and face covering situation for your orchestra?
Yeah, so for NACO, all of our string players are masked at all times. And our wind and brass players are required to wear masks at all times except for when they're actually playing. So they've been really, really good about replacing their masks whenever they have extended rests. And of course, if they need to speak at any time and while they're on stage, they're really good about putting their masks back on. So that's where we're at with masking. And then I guess the other thing I would mention that we're doing this fall, we don't currently have a testing mandate at the Arts Centre. But since March of this year, we've had a contract with Shoppers Drug Mart for rapid antigen testing. And last season, our wind and brass players were using bell barriers. But this season, we're permitting those musicians to remove their bell barriers if they participate in the rapid testing program. So we asked them to go get a rapid test within 48 hours of the first service in each work week. And as long as they do that and provide me with their negative rapid test result, then they're allowed to remove their bell barriers for the week. And they have all been participating in that every week. So that's been, you know, super, super helpful for us. We've had some string players take part in that as well, and we've certainly, you know, communicated to our orchestra that it's available to all of them, and with the uncertainty of the Delta variant, and as well as, you know, young children still not being able to be vaccinated, and we have lots of musicians with young children in our orchestra. You know, we've opened up this option for going to get tested multiple times a week. So that is available to our musicians.
Can I just interrupt you for a second, just
yeah.
to clarify?
Mm-hmm.
Does that mean that if I were a musician in your orchestra and I had a vulnerable family member, say an elderly parent, would I have access to that testing program as well?
You as the member of our orchestra?
Yes.
Yes.
Yeah, not me just as Janet.
No. we did. We considered, could we open this up further to allow family members of orchestras to use the program, but we can't. But you know, we've communicated to our players that Shoppers Drug Mart and possibly other pharmacies in town are now offering this service just as a walk-up service that anyone.
So it's an additional layer of reassurance that your musicians have access to.
Exactly.
Wow.
Yeah.
Okay. And
I should just also mention that in terms of that rapid testing program, we've expanded it to our conductors and our soloists as well. And so if they take a weekly test, then they are allowed to remove their mask on stage, which has been, you know, our music director, Alexander Shelley, jumped at the opportunity when we opened this program up to him, because he's been really wonderful about wearing his mask all the time. But, you know, we could tell that it's a struggle for him and other conductors. And James Ennis made use of the program when he was with us last week, so he was able to play without his mask. So that's been very useful.
It sounds like you've really had tremendous support to the program that you've put in place. And just an observation, do you still have to do all your personnel manager work in addition to this?
Oh, of course I do.
Okay, I'm just kind of imagining that you've kind of doubled your workload, and congratulations to you for adding this and yet making sure all the wheels are turning smoothly. So you have some photos to show us, and we'd love to see those.
I do. I just have I thought it would be interesting to see a few photos. It's mostly from last season. Okay, are we seeing those here?
There they are.
So there's a picture of Chris with one of the early masks that he was experimenting with last season, an actual playing mask. As well, you can see all the plexi we have on stage. And I did want to show you how kind of encased our winds and brass ended up being as we layered on the levels of plexi over the last season. So you can imagine that we're quite happy to have all of this gone now. And there's Chris looking a little bit forlorn, contemplating all this plastic on stage. And then I just wanted to show, we're very fortunate at NACO to have a really large backstage area. So these are all our unpacking stations. And you can see there's papers on each one. That's individuals' names. Everyone's been assigned an unpacking station backstage so that we keep everyone distanced at all times. That's the other side of the other wing. And that's all the way upstage. Our winds and brass have been there. And then this is a picture we did a big video project that's out on CBC Gem now called Undisrupted. And I just thought it would be fun to share this program if you, this picture, if you really want to distance your orchestra, you just build risers and send them all the way into the house.
Oh my goodness, that's incredible.
So, isn't that?
Wow.
Yeah, so that was a neat experience, but yeah, certainly the setup was dictated by the pandemic that we're living through. And then finally, this is just a kind of lighthearted personnel manager side of things. So last season, our daily COVID assessments, it was not a great process. We were doing these form fillable PDFs and every musician had to email me their daily screening each day. And I had to ensure that I had received, all 55 forms each day. And then I had to send them off to the NAC health and safety manager. So I, every day I had to chase a handful of musicians to get me their forms. And so I instated this donut penalty.
And how many donuts did you receive?
I did get quite a few, actually. So that was a perk.
Amazing. Amazing. Well, that's a tremendous insight to be able to see how it actually played out. Thank you for sharing those photos. So now that we have a sort of picture of what it's like to work at the National Arts Centre Orchestra, I want to go back into talking a little bit about that reopening committee. Who's on it and why was it important for those people to be involved? Sort of like what parts of the orchestra was it really critical to include? So I'd like to start again with you, Meiko. And also I understand that the committee's composition has changed a little bit over time. We've been at this for a while, so you could give us some insight there.
Yeah, so our reopening committee consists of our orchestra manager, Nelson McDougall, orchestra operations manager, Fletcher Gailey Snell, and myself. And then during the first year of operation for our committee, we had Christopher Millard with us, who is still a member of the committee, as well as trumpeter Steve Van Gulik. So those two musicians represented the orchestra on the committee. Steve has left the committee this year, and taking his place is a violinist, Winston Weber. And also during our first 6 months of activity, we were joined by NACO's technical director, Pasquale Cornacchia, who was indispensable in helping us navigate many of the in-house technical challenges. And Pasquale continues to play an advisory role to our committee. So yeah, it has evolved a little bit over time, just kind of based on what's been going on in each member's life. But most of us, have kind of stayed consistent, and it's been absolutely invaluable having wind and brass players on our committee, of course, because that's been a large area of our focus. But I found this season having a string player as part of the committee has been really helpful as well. Just, you know, I think some of the string colleagues welcome having one of their own members that they can kind of talk through some of these issues with, and know that they have a string player kind of on their side.
Yes, and to give the perspective, because you have many, many perspectives in a group that large. It sounds like you've been very successful in representing all of those different groups. So when it comes to, you've got this committee created, and obviously when you were figuring out how the committee was going to operate and what kinds of planning you were going to do, you needed to kind of settle on an approach or a philosophy around health and safety. And I know when we talked about it, the words above and beyond came up, wanting to make sure that the people on stage were both comfortable and ready to play, and not just looking to the bare minimum of the government regulations. So I'd like to talk to you, Chris, and see if you can give us a little more understanding about how you reached that place and what it meant.
You bet. So Janet, I think above and beyond has indeed been central to our thinking. And I think at this point in the conversation, it'd be good to have a little history, take you through the evolution of our decision-making, starting with that unbelievable utter confusion that the whole world was dealing with last summer and early fall. So I should acknowledge that the National Arts Centre has, of course, the resources to weather the COVID storm better than many organizations. And we do have several hundred employees here and a large infrastructure to support many multidisciplinary activities. But as I'm sure everyone participating today discovered last year, nobody had any real expertise or experience with a pandemic. We couldn't find any 1-800 numbers to dial about trumpet aerosols. Anyway, the NAC has always maintained a health and safety officer, and he was quick to begin implementation of public health guidelines. But it won't surprise any of you that the initial focus on sanitation, social distancing, filing daily health reports, these were not addressing the specialized concerns of an orchestra. A public institution like the National Arts Centre tends to be cautious and often constrained by concerns such as privacy issues. So orchestra manager Nelson McDougall and I were also part of the NAC's Corporate Health and Safety Committee last year. And when we realized early on that there was resistance within the center to something as simple as temperature checks for privacy reasons, we started to look for ways for tightening up the specific protocols for the orchestra itself, backstage and on stage in our home environment. Now, as Meiko mentioned a few minutes ago, temperature checks were limited to the backstage, so we had no objections from the administration about that. But that's kind of the first step, Janet, of what you refer to as above and beyond. So as we began work last fall, we were able to craft some additional steps for our musicians and for any of the crews stepping onto or into our performing spaces. The protocols issued to the orchestra last September are now available on the OC website if any of you are interested in taking a look at them. And I'll bet that most of you have crafted similar documents over the last year. I think from our current perspective in September of 21, there's not a lot in these recommendations that are particularly insightful or prescient, but I should remind you that in the summer and early fall of 2020, COVID transmission was still presumed to be largely fomite based, in other words, physical contact. So I don't know about you, but many of us were washing our groceries in the first months of the pandemic. Meiko, can you comment?
Yeah, certainly. So we made a decision last summer to focus our energies on aerosols as the main vector for disease transmission. And, you know, looking back on it, I believe we were several months ahead of public health guidance on that. Chris can certainly answer more questions about that later. But last summer, we decided to focus our communication to the orchestra on 3 specific areas. The first being air exchange rates and the dynamics of airflow patterns on our stage. The second being masking technologies and their utilization. And the third was the central problem of wind and brass participation. So we were able to get some really good data from the building engineers about the NAC's HVAC systems. And we were able to determine the average hourly exchange rates for different parts of the building. The NAC is an old building. It was built in the late 60s. And its HVAC systems, although they have been upgraded, are not as efficient as many modern concert halls. So we were able to determine that our onstage exchange air rates were measured at slightly more than 3 times per hour, which is definitely not comparable to more modern halls, but it is still within the minimum requirements suggested by various occupational and health authorities. Chris, did you want to continue?
Yeah, I'll continue with that whole line. We tried to stay on top of the very uncertain science about airborne viral transmission. Any of you who've investigated this subject will know that trumpets and flutes are certainly either the most lethal and dangerous or absolutely the least dangerous instruments for potential aerosol transmission. It really depends on which study you read and which you trust. So I sifted through a ton of almost incomprehensible and conflicting data, but we understood that unless the NAC were to become a string orchestra for a couple of seasons, we had to make some decisions based on very little information. One of my more successful outreach efforts were to the professors at the University of Utah who were embarking at the time on a comprehensive study of Abravanel Hall for the Utah Symphony. They sent me some initial computer simulations of their work, which showed some rather frightening aerosol emanations from the winds and brass on their stage. So our less rigorous but still useful adaptation of their modeling helped when we started to spend time on Southern Hall stage with our theatrical fog machines and tried to make sense of the predominant airflow patterns on the stage. So we were, of course, looking to see if brass and wind section aerosols were flowing downstage and increasing the danger to our orchestra string sections. Now, some of you will be running orchestras in multi-use spaces and others in dedicated concert halls, and you've undoubtedly come to conclusions about the best air exchange strategies for your particular stages. I think the biggest blessing that we had at the National Arts Centre was that Southern Hall has the tremendous flexibility of a highly modular shell, which was installed only 4 or 5 years ago. This modular shell design allowed us to open sections both at the sides and above the orchestra, above the stage, and we were able to significantly improve ventilation across the whole stage. Now, as a musician, of course, an open shell's less efficient acoustically, but of course, there was never a question that we would sacrifice sound for safety. Meiko?
Yeah, so early on, the Ontario regulations were demanding plexi partitions on stages. And based on our reading of the emerging research from both Europe and the States, we were only briefly enthusiastic about using these plexiglass barriers. We came to the conclusion on our own that the viral danger from exhaled aerosols was not effectively managed by barriers, and enclosing the musicians in glass cages really ends up being of little statistical benefit. But the provincial rules mandated that we use them. So we used those fog studies to at least use our required plexi in a way that helped redirect the downstage airflow up and over the string sections. That was at least our plan, and we hoped for the best there. And then in terms of masking, before the orchestra returned to work last fall, we were investigating masking technologies. The center purchased numerous different types of masks, including some very expensive antimicrobial masks for all of the wind and brass players. And at that time, they seemed to promise a safer alternative for constantly handling than the cloth masks that we were all using. And then as the season progressed and the general availability of level 2 and level 3 procedural masks, then the flood of KN95s and KT94 masks in the winter, we began to focus on the importance of mask fit as well as filtration. So I believe we've included on the OC website a document that we issued later in the winter, which was focused on masking and instructing all musicians how to increase their personal protection with proper masking, with the focus on the good fit of the mask. And that was something that was supervised by myself. I was doing visual checks of everyone's masks at the same time that I was doing their temperature readings when they came into the hall. And so by late winter, I could see that everyone on stage was being very careful and that their masks were really effective. Chris, do you have anything else to add?
This, of course, takes us to the elephant on the stage, or I should say the elephant sitting on the wind and brass risers, this whole subject of safety for wind and brass players. But I think it's a big subject. I think we might return to it later in a Q&A
Yes.
in this seminar.
Yes, we will. Thank you both. The level of detail and the level of research that you have carried out is really, really impressive, and how you have applied it so specifically to exactly what you do. Wow, that's a lot of work, and you should be really proud of that. So we are going to be talking a little bit about the challenges, but just to lighten the mood a teeny bit first, I'd like you each to tell me a little bit about a silver lining moment that you have experienced. And it doesn't need to be a big thing, just something that was sort of a plus. And I'd like to start with Meiko.
Sure. I'd have to say opening night just a couple of weeks ago would have to be a silver lining moment for me. It was the first concert that we've had an actual audience in the hall, and what a difference that made. I'm really proud of the work that NACO was able to do last season. We did end up live streaming 7 orchestra concerts and as well that the Undisrupted project that I mentioned earlier. But all of that was done in a bubble. It felt like with no audience. It's a completely different experience. And so, yeah, it was just so wonderful on September 10th, our first concert, and I was, right in the wings. So I sent Alexander out, and as soon as he walked out on the stage, the whole audience was on their feet and cheering. And it was just, my heart, I was almost crying. Like, it was just such a special feeling. And as well as at the end of the concert with the standing ovation. And it's amazing how going from having no audience to having 350 people in a 2,000 seat hall, it felt full, whereas in previous years, if we had that small of an audience, it was a much different feeling for everyone. So it's interesting how our perspectives change.
Well, and I think it felt full because everyone's hearts were so full.
Absolutely.
That's it's amazing. Chris, I'd like to ask you the same question. What's the silver lining for you?
Oh boy, after such a poetic response, I hate to be unimaginative. I think the biggest silver lining for today is that we haven't had any COVID in the NAC orchestra. Yay! But, I'll add something which I think will be of interest to you, because I know there's quite a disparity in terms of intent regarding how much safety protocols to take on. I spent July and August of this summer, as I do every year, performing at several American chamber music and orchestra festivals, all without masks and without any social distancing. And I can tell you that was an unbelievable shock, because by mid-July, when I arrived in the southwest states, Delta was making a big headway in some of the states that we were in. but we were in vaccination bubbles. And I guess the silver lining to that is knowing that vaccines, if given the chance, would eventually, hopefully, allow our old lives to return. But between low vaccination rates there and the Delta variant, I knew that I would be returning to Ottawa still strongly advocating strong safety protocols on our own stage here. Perhaps later on in the discussion, we can get into the different viewpoints that some of you may have about protocols and testing in fully vaccinated working environments.
That's a really great idea. And we'll make sure we get to that in the Q&A. I'm just going to throw in one little silver lining. I, over the summer, was able to attend some small cabaret shows that were under canopies in Stratford at the Stratford Festival. And I loved that moment. The first show I went to where the musicians were tuning. That little, like before even the singers came out, that moment where you just felt like this is not recorded, this is real. And I have to say, they were singing a lot of uplifting songs, but I was dribbling little tears into my mask. I was just so moved to be there. So silver linings, I hope everyone listening has had their own. Now we're going to just shift a little bit, and we're going to talk about the challenges and the lessons learned, things that came up during last year's experience and how you're applying them now. Some of the things that I'd love you to touch on would be things like the information gaps, the overload, who do you consult, how do you distill information from a whole bunch of different sources. How can we apply all of this, I call it the fire hose of information, to our space to keep everyone as safe as possible? So I'm just going to, turn my page. I know this all sounds entirely spontaneous, but let's go to Meiko.
Sure. Well, as Chris suggested, we're definitely not ready to abandon our above and beyond strategy at NACO. We entered the fall operating under the assumption that COVID transmission in schools could find its way into the Arts Centre, and we're being very respectful of the Delta variant. So with most of us are less concerned at this point about severe illness or death from COVID, because we expect that most breakthrough cases in full vaccinated environments are not likely to be severe, though the possibility remains. So above all, our primary rationale for continuing with our strict protocols and testing is to help protect our musicians with young children. I myself have two kids under 12, and I'm personally counting the days until there's approval to get them vaccinated. I know it's going to make me feel a lot more comfortable.
Yeah. You know, Janet, your question about who to consult, wow. I mean, hasn't that been the biggest problem from the very beginning? Everybody's making this up as they go along. I think this realization came very strongly to me last winter. I was having a conversation with one of the local city health physicians who was at the center when we first opened up a drive-through COVID testing facility within our parking garages. So after a few minutes of conversation with him, he suddenly said to me, it seems that I know as much about workplace aerosols as he did. And believe me, I don't know much, but this is the condition. And if I may say, our committee thought about contacting Vera Etches, who is a very capable head of Ottawa Health. But we decided that really, I don't think that she would have time to read a University of Minnesota study on the appropriate fabric weave density for a trombone bell barrier. And I think that's about as concise a summing up of what all of us and all of you have had to cope with. There weren't any epidemiologists with knowledge of symphony orchestras.
I agree. That's absolutely true. And, you know, there have been lots of people trying to wade through the quagmire. Meiko, can you tell us a little bit about your perspective on having to try and research all of these issues?
Well, it was quite overwhelming, to be honest, at the first 6, 8, 12 months of the pandemic. Yeah, it was. I feel blessed that Chris was part of our committee, because he's got a real brain for this kind of research, and as well as Steve Van Gulik, who used to be on our committee. They really armed themselves with as much of the information as they could, and helped distill some of it for myself and the other staff members on the committee. Because, as you mentioned before, we were still trying to do my personnel manager job, and at the same time trying to become, experts on this new virus. So certainly a challenge.
All right, and one of the things that you had mentioned was that there was an opportunity for Alexander Shelley to remove his mask. So was that a shock to the audience, to the orchestra, or how did they respond to that?
No, actually, I mean, that's something that we've been really, we've tried to do a better and better job of communicating with the orchestra as this has gone on. So in terms of Alexander removing his mask, nobody was shocked when it happened, because we had sent out a memo to the orchestra explaining that he was going to participate in the testing program. And yeah, generally we found that musicians have accepted the decisions that have been made about the workplace standards, as long as they're given a proper heads up and respectfully kept in the loop of the decisions that are being made. And it has also really helped that we've had musicians like Chris on our reopening committee, who are trusted and respected by their colleagues in the orchestra. So we've done our best, and as I said, I think we've gotten better at it as the pandemic has gone on, about keeping the lines of communication open with the orchestra and keeping them informed as changes are coming.
If I could just briefly weigh in, excuse me. I think we realize, the question is too much information a bad thing, and I think it is. There wasn't much point at any time that we should circulate to our musicians. We had maybe 2,000 or 3,000 pages of information on studies, but it's meaningless to send out information that you can't digest, even if you're focusing on it. People don't need to know the condensation rates within the bore of a trumpet. So what we had to do is we had to take a responsibility, even though we didn't know much. Take a responsibility, make some reasonable guesses, and tell the musicians what they should do. And I think in most cases, that's the most effective strategy, where there's too much unfiltered information. But I think the simplest thing, and it relates to what Meiko just said about Alexander Shelley and his masking, the simple changes that can be observed visually by everybody need to be communicated ahead of time. Because people get used to seeing a certain thing and start to trust. I had talked to all of our wind and brass colleagues in the days before we removed our plexiglass barriers, and I said, I want to remind you all that the science has not supported this for 7 or 8 months, and we've done it because of the province. Are you guys okay if we let this go? And they were relieved, and the string section knew about this. So, just simple information, as long as you get it out ahead of time. And I think we were guilty a few times of not getting information out ahead, and Meiko referred to that learning experience.
Yeah.
Well, and sorry, I just wanted to add to that, because it was just 2 weeks ago that we removed all the plexi from the stage, and I crafted an email to the orchestra saying, okay, here are some updates that are coming. The first thing that's going to be changing is we're going to remove the plexi this week. And then I got up on the podium at the top of rehearsal and said, I hope that you all saw the email that I sent you, because not everyone reads their email, and you have to find different ways to communicate to people as well to get the message across. But I was delighted with the reaction that I got when I said, you'll notice that the plexi is now gone from the stage and the entire orchestra cheered. So that was great.
And of course, because they had been given the context and advance notice, people are going to be more positive about that. Just one of my observations in terms of how you've communicated is, I've seen this in a number of different arts organizations where the safety culture has actually been strengthened by this pandemic, because it has forced people to really look at health and safety as something that is mission critical, that you can't just set it aside. And that the most important thing you have to do is involve the people who are most affected. So, if someone's off in an office somewhere writing a protocol without having those conversations with the people who are going to live it, it's bound to be ineffective. And I think, I'm so excited to hear about how hard you've worked on this and how you've learned from, maybe one email wasn't completely thorough, so the next one had more details. None of us, even today, I'm not an expert, nobody is. We're figuring this out as we go along. We're adapting to changing science, because that's what science is. It improves and it evolves. So I think that you are going to see a strengthened culture in your orchestra as a result of this, and that's a really great thing. So I know you're facing new challenges this fall. So we sort of go in different phases of this pandemic. Fortunately, we've been able to resolve the issue of barriers, which for a very, very long time was problematic. Now we're into the whole world of vaccination. And I'm curious to know about how you are addressing the vaccination questions from a professional orchestra standpoint. So thinking not just of staff and core musicians, but how do you deal with guest artists and audiences? And I'd like to put this question to Chris.
Okay, so it's an incredibly important question, and it's very, very current to our thinking. If we're just going back about 8 weeks to the midsummer, our REOP committee agreed that we would do everything we could to advocate for mandatory vaccines for all employees in the building. And we had, I want to say that we had total support, not just from the orchestra committee, but from Local 180 of the Musicians Union. Everybody was on board. But with a bureaucracy like the NAC, as a federal institution trying to maintain consistencies with federal policies, this was a really tough sell in August. And the HR department was very reluctant to take a stand on vaccine or testing mandates. It was a really difficult situation. And I have to tell you, by late August, I was starting to become quite concerned that we were going to have a real conflict on our hands. But then, thank goodness, the federal government announced these vaccine mandates for federal employees. So we breathed a huge sigh of relief. And the decision came down that there would be an implementation within a couple of weeks for the Arts Centre. And the thing is that you all know this, whether you're on the desk side or the performing side, an administration, all administration, certainly this one here, they're very caring people. Now, I've alluded in this conversation to some of the constraints in the bureaucracy and the impediments to decision making, but really, I know that when the mandates came in, the vaccine mandates, all of the people in the management would have been breathing the same sigh of relief, because it took the pressure off them. So anyway, as soon as we knew that everybody would have to be fully vaccinated to attend the first rehearsal on September 7th, and all employees in the building, from stage door to maintenance staff to IATSE crew, everybody was going to have to be fully vaccinated. As soon as we knew that, then we turned our attention to audience requirements, which was, I have to say, completely out of the mandate of our reopening committee. This is a managerial decision, but we felt that we had to start putting some pressure. So we knew that for the audience, masking and health questionnaires would be required for entry to a concert. but the Arts Centre at the time wasn't ready to mandate vaccines for patrons. So again, the government stepped in soon after, made the same decision for audiences, and alleviated a huge problem for us, and we were all much happier. And incidentally, 2 days ago, Wednesday, was the first day in Ontario for restaurant or theatre patrons to show proof of vaccine. So we actually haven't seen that implementation at the Arts Centre yet. You know, whatever your concerns might be about that minority of the population that remains vaccine hesitant, I think we can trust that a huge majority of our often very mature symphony audiences are totally approving for their own safety of having their vaccination status checked upon entry.
Yeah, and I agree with that sense. I'm certainly hearing that from a lot of people, that it's something that audiences want. You know, they want to have that certainty. And also for managements, if they can, you know, make sure that people are vaccinated, then there is hope for increased capacities, which, you know, we do want our organizations to stay financially viable, and that's going to be important. So I'd like to come back to the idea of the rapid testing, because you have an arrangement through a pharmacy. So NACO, can you tell us a little bit about how that came to be and how it works?
Yeah, well, I mean, we've been doing this since March with it's the Shoppers Drug Mart, and it hasn't been smooth sailing for sure, but you know, we welcomed the opportunity to provide this sort of extra layer of safety screening for our musicians. So we had a lot of challenges in the initial use of the pharmacy rapid testing program, mainly because we discovered that we were the only large employer in Ottawa using the program. So with there being such a large number of Shoppers Drug Mart locations participating across the city, we found that many of the pharmacy employees were not actually up to speed on the employer sponsored testing program, simply because it was just kind of our musicians and a few of our staff members that were using it. So I ended up having to make lots of phone calls to Shoppers senior management, and lots of emails and communication back and forth. And yeah,
so you were kind of teaching them how to run their program.
Well, not exactly, but I was keeping them in the loop that, okay, well, I had musicians go to this location, and the staff there didn't know what they were talking about, and made them pay for their tests, and there was a lot of reimbursement, and
oh my goodness,
there were certainly hiccups, but we've seen a significant improvement in the delivery of that program since September, and so we're going to keep going with it, because it's certainly,
it sounds like there's a lot of value in it.
It's certainly appreciated by the people who are using it in the orchestra. Yeah.
Just a related question. There are some programs that allow for free rapid testing. Was that something that you looked at, or is it because of the size of the National Arts Centre, are you not eligible for those free rapid tests?
Yeah, I mean, we're aware that those programs are coming about now, and we are looking into it, but it's unclear whether the Arts Centre is going to be able to make use of that. I don't know, Chris, if you know a bit more.
Yeah, I think we should discuss this, because it's very important. I know that involved in the Zoom call today are several of the administrative people from the Toronto Symphony. This is a very important adjustment that we're witnessing in Canada right now in the last several weeks about self-administration of screening tests, specifically the rapid antigen screening program. Until early in the summer, Health Canada had always insisted that rapid testing could only be administered by trained personnel. I suspect that some of you in your own province have seen emerging changes in attitudes about home testing. Some cities have been distributing test kits to moderate-sized businesses for several months. That's been the case in Ottawa. As part of their program to supply employers with rapid antigen testing in Ontario, Ontario Health has extended the definition of trained individual to anyone who watches a brief video tutorial.
5 minutes.
My
and
understanding
you're good to go.
is that, yeah, you're good to go. My understanding, the Toronto Symphony is leading the country with this because I understand they're right at the beginning of a rollout of home testing kits being delivered to their musicians. So in addition to the provincial and municipal public supplies, rapid tests are also available now for retail sale online. Some of you might have already investigated or tried these home kits. I did one last night. Here, this is exactly there. You know, there's your home testing kit. They're really easy to use, and there are 3 brands available right now. The Abbott PanBio is the one that the pharmacies are using. I believe, correct me if I'm wrong later, but I think the Toronto Symphony is using the Abbott PanBio, and there are also 2 other brands, and you can buy these things online. The thing that I should say, there's a huge amount of discussion internationally about home testing. And, you know, the goal is to prevent unnecessary absences from schools and workplace. It's so efficient. And I'm personally betting that we're going to see a huge increase in availability and usage of home testing across the country in the next few months.
Yeah, I think it's definitely a topic to keep our eye on. Because, you know, like other aspects of this pandemic, that is evolving. It's very much evolving right now. So I want to just pivot a little bit to just a quick discussion about changing regulations. So when we saw the relaxation of certain regulations and we try and navigate what we're allowed to do versus what we're not allowed to do, how has it been, and I'm going to throw this one to you, Meiko, trying to decipher the province's messaging? And I think every province has some challenges in this regard, but just speaking to what your issue was, let's maybe use the barriers as an example.
Well, sure. So our most recent reinterpretation of the Ontario guidance was for the removal of the plexiglass barriers 2 weeks ago. And it gradually dawned on us when we came back to work this September that there had actually been language removed from the Ontario guidance in between phase 2 and phase 3. So it wasn't so much what it was saying, it was what it was not saying anymore.
Yes.
Right. And so it seemed that a reasonable reading of the references to barriers or not, the non-reference to barriers, indicated that they were no longer necessary and certainly unlikely to provoke any concerns by visiting city health inspectors if that were to occur.
Wouldn't it have been easier if someone had just put out a summary and said, now?
Sure would have.
Because I've been including that in some of my things, saying, okay, the only thing about barriers in Ontario is you have to separate your audience and your performers by 2 meters. If you can do that, you don't have to have a barrier. Now, there will be some cases where there may be a preference or a comfort level. Everyone's got them on hand. So if there's, you know, some reason that's specific to what you do, you can certainly add them back. That's not a problem, but it changes the whole equation. So new challenges every step of the way. Meiko, I'm going to continue with you and ask you what implementation of your plan is going to look like on the ground for this season.
Sure. So I've already explained our protocols, kind of what things are looking like as of this week, but we are anticipating some changes coming our way over the next few weeks. And these are, for us, they're being necessitated by 2 major recording projects that the orchestra has. So NACO is actually finishing up a cycle of Brahms and Schumann symphony CDs. And we've been working on this cycle for several seasons already. It predates the pandemic. So it's really important for the continuity of these recordings that the musicians and the sound engineers are able to get closer together again. So, you know, we are maintaining the masking and the voluntary screening programs for the foreseeable future. But I think reducing distancing on the stage, which is allowable under the current status, is going to be agreeable to everyone. And again, you know, I've been very careful about communicating to the orchestra that this is coming up, and our string players are going to start sharing stands again for that recording project. And I've posted the roster, and they can all see that they're sharing stands again. And I've had no pushback, which is great. And of course, through all of this, we are going to continue to monitor what's going on in the city, and if we see a sudden increase in transmission rates, of course, we are prepared to modify our plans accordingly, you know, as we go through the fall. Yeah.
Being very responsive as you have been throughout this time. So I'm going to come to Chris just to ask about what do you anticipate needing to adjust or adapt as you go? Who will you be consulting with along the way, and how will you determine success?
You know, I'm a woodwind player. In addition, I mentioned early on in the seminar that the wind and brass players are like the elephant in the room in regard to safety for returning orchestras. People are always thinking about how do you protect yourself from being infected by the flute player. And boy, that was everybody's fear for a year. And I know that it's hard to describe, but I think it had a real psychological effect that those of us who make our living using our breath, breathing deeply all the time, for us to have it in the background mind when we're even in a masked environment, when people around us are taking their masks off, even for short periods of time, and you're worried about contamination of aerosols and that, kind of affects your psychology of your relationship to your instrument as a voice and as a singing, breathing musician. So this has really changed for me with the vaccinations. And, you know, I'm not pie in the sky, and none of us should be, about the meaning of, we know that full vaccination is not the same as full protection. We all know that, but full vaccination is likely to keep us relatively healthy. And yes, there will be breakthrough cases, and yes, there's a small amount of danger, but in general, when we combine different levels of mitigation and different protocols and put them all together, you eventually start raising your sense of personal comfort. And for me, this fall, I'm finding myself much more comfortable inhaling and exhaling into my instrument on stage. Other part of your question, I think, might have to do with relationship with audiences, which is, as Meiko said, you know, it's the magic of everything. I gave an online talk just last Sunday to a large group of the NAC Friends, which has been our long-standing volunteer group. And I used that opportunity to express my concerns about how do you maintain the habits of going to concerts? And especially, do we have a concern about a loss of our ability to have sustained attention as listeners? The problem is virtual music has been a lifeline between performers and audiences during the pandemic. And I get that, it's been great. But ultimately, the distractions of the digital world do end up diminishing the vitality of the listening experience, don't you think? So the point is, I'm positive that our audiences are fairly fatigued by digital concert going as their sole listening experience. So I guess being back on stage is really about proving once again that live music is best.
Yes. And it is a different experience when you're watching something on your TV and then you hear the dryer finish and you go and take the load out, you come back. Like it's a fundamentally different experience. And I've noticed it, even the short shows that I've been able to go to, is we need to be immersed in that way. We need to have that be our focus. So we're going to get we're very close to getting to our Q&A portion, but I have a question just briefly for Meiko about communicating with other orchestra stakeholders and the context of the larger institution. I know with your, the orchestra is a component of the National Arts Centre, and there are all different areas, departments, activities that are going on. Do you have just like maybe a couple of sentences to go like, that was unexpected, or this helped, or anything like that?
Well, certainly, I mean, within the context of a larger institution, the communication is certainly a challenge. There are lots of committees and subcommittees. As Chris mentioned, the larger NAC has a reopening committee, and as the orchestra, we formed our own reopening committee, but we had to take our initial cues from what the larger committee had decided, and then we kind of drilled down on creating specific protocols for the orchestra from there. But all of our policies have been shared back with the NAC's health and safety officer and the larger reopening committee, and just making sure that they kind of approve of the other decisions that we've made that are specific to the orchestra. And then for the orchestra, for the musicians, it's been important that we are gathering information from other areas of the building as well. For example, front of house and marketing, so that we understand what the policies are that they've put in place for concert goers. And then, I have to share that information back to the musicians, because now that we have in-person audiences again, they of course are going to be sharing, the musicians are now sharing a space with patrons, and they want to know how is the audience being screened and all that. So it's just, we can never stop thinking about sharing of information, and do you have all the information, and have you passed it on? So yeah, it's just constant.
And then there's that other job you do too.
Yeah.
Oh, and then there's also being a musician full-time that you do. Both of you, it is so incredible to have the opportunity to talk to you and to really understand how deeply you care for your orchestra, every individual and everyone who is supporting you on that stage. That really comes through loud and clear. I hope you have people who are taking care of you. And I would like you to just wrap up by give us a little bit about what helps you to stay positive through this, something that you're feeling optimistic about right now. And I'm going to go to Chris.
Okay. I say my optimism is focused in two directions. The first is the collective willingness within our NAC community to balance safety with a slow and patient return to work. Now, I know that some of you on this call are in communities where the politics of vaccine mandates and the politics of business restrictions are more heated than they are here in Ottawa. Despite the descriptions of the bureaucratic nature of the NAC, I'm really constantly aware that the constructive and empathetic attitudes throughout our management are always present. I'm optimistic about that. And secondly, I guess the number one thing, my optimism is based upon the hope for an early introduction of the RNA vaccines for the 5 to 11-year-olds, which I think is going to come much sooner than we may know. And I think we're all starting to get a picture. Not just musicians, but everybody in Canada, North America, Europe, throughout the world, we're starting to understand that the next 2 years is going to be about a very slow and gradual and fraught transmission from COVID as a horrid pandemic to COVID as a somewhat less terrifying endemic condition. The epidemiologists are saying to us that we're all going to experience the disease at some time, but probably in milder forms and probably as manageable as seasonal flu or severe colds. So my hope is if internally in the orchestra and externally our whole society, if we can adapt intelligently to the inevitable mutations that are going to happen, then I think we can probably say that the worst is almost behind us. And that's a big source of optimism.
I'm very happy to hear that. That's very, very optimistic. It sounds like maybe we're at not so much the beginning of the end, but certainly the end of the beginning. Meiko, can you just give us something? What are you feeling positive or optimistic about?
Well, I think a lot of the same things. And certainly for me, as I mentioned before, I have 2 young children, and I'm going to personally feel a huge sense of relief once they can get vaccinated. I've been kind of holding my breath since they returned to school a couple of weeks ago, just wondering how this fall is going to pan out. And I really hope that the schools don't get shut down like we experienced so much last year. That was really, really tough.
Mm-hmm.
I feel more optimistic now that, you know, we have a fully vaccinated orchestra and a fully vaccinated staff. I certainly feel a new level of comfort and safety when I go to work, and just kind of seeing the plans for the orchestra season, which is you know, a lot more a fulsome plan than we had last season, with the hope, but dare I say expectation, that we aren't going to get shut down again. So just being able to go to work regularly and feel just a little bit more secure that we're going to get to do everything that we've planned to do. So I just feel optimistic about the season, and yeah, that we've kind of gotten through the worst of this. I really
Excellent.
hope.
Yes. And for me, I feel positive when I get to talk to folks like you. It really, you know, I'm doing a lot of my work in my little home office, talking to a lot of different people. And that is the boost for me. That is, you know, seeing that passion for keeping music alive. That's it for me. That's what I need. And that's what I'm getting certainly today. So I'm going to toss back to Lauren. I believe Lauren is going to help us with the Q&A. Is that right, Lauren?
Sure, yeah, we've had a few questions coming in through the chat, and I think still more coming in.
Okay.
But one coming from Krista in Ottawa is, without the plexiglass, what is the spacing between musicians, and is it the same between strings as wind and brass? So throwing that over to you.
Yeah, so up until now, yes, we have continued with the same distancing that we had with the plexi, now that the plexi is gone. And so that's a minimum of 6 feet between musicians. And with our winds and brass, we have, when possible, we've increased that distance a little bit. Our stage crew, when they set up, they have their ruler, their 6-foot ruler that they use, and then if they can squeeze out a little bit more distance than they have been. Now that is going to start changing, as I mentioned, because the distancing on stage is not required anymore in the current phase. So we are going to start shrinking that distance. The string players are going to be sharing stands. I had our technical director produce his first version of the drawing for the week where we're sharing stands, and he produced a drawing that was all the way back to pre-COVID times, and I saw it and I was like, oh my goodness, that's crazy. Did we ever look like that? I mean, everyone looked like they're on top of each other. I said, I don't think we can go from 0 to 100. So there's still going to be more distance than there had been, but it's not going to be 6 feet anymore when this is 2 weeks from now when we go back. Chris, do you have anything to add to that?
No.
Okay.
Oh, maybe I'll just add that the psychology of it all is dependent upon layering. So some of you may be more concerned about physical distancing because of the overall space in which you're working and the air exchange efficiencies, and that affects the psychology. I think if we were performing a very small enclosed space, we would naturally feel a little bit less comfortable by reducing distancing between musicians. And as we've talked about earlier here at the NAC, we have this very open fluid air exchange rates, which affects the psychology, which then makes the inhabiting the closer distances more comfortable.
We have a modular shell at the Arts Centre, and so we've got all these side panels, doors that can be open, and pre-COVID they would all be closed. But since working through during the pandemic times, we've had all of these side panels open, and so that increased the airflow on the stage as well. And as when we come back to work, we're recording the Schumann 4 as part of this recording cycle, and our audio engineers already asked if we can turn off the ventilation and close all the doors, because that's how we've done all the previous recordings, and it's just not an option right now. So there's certain protocols that are relaxing, but there are other ones that it's not an option, and we have to learn how to adapt to work with them. And they are fantastic audio engineers, and I have no doubt that they have some tricks up their sleeves, and it's going to be fine.
Thanks, everybody. One other question that's come in, and I see Catherine's replying a bit in the chat, that Lawrence is asking, what are the current regulations versus recommended practices for masking and distancing of wind and brass players? So maybe Janet or Chris, I don't know if you want to take that on.
Well, I'll take a swing at it and then I'll throw it over to Chris. So at the moment in Ontario, and this may vary across the country, but in Ontario, there is a general compliance section of our regulation, which identifies that when masks must be used. But there is also a list of exceptions. Exceptions include things like medical conditions, disabilities, being 2 years of age and younger, rehearsing and performing. So there is an exclusion. It's not required. That said, it's still, for everyone who is familiar with that beautiful image of the Swiss cheese model, I hope you all have it glued to your walls. Masking is one of those slices of Swiss cheese that's very important. So most people haven't tossed it aside completely, even when they are working on stage. But Chris, what's your experience with that?
Well, my medical condition is that I play the bassoon for a living, and therefore, masks present a little bit of an impediment. Very early in this session, Meiko showed a photo of me playing through a slit in a mask, and we actually tried all that stuff. But as you say, we do have an exclusion. So because it's all areas of gray and never black and white, let me describe to you how we all interpret those gray areas. We have to have masks on to enter the building, get in the stage door. We have to wear masks everywhere in the building. We have to wear masks backstage. We wear masks when we walk onto stage. And when we sit down at our chairs, when we're ready to play, we take our masks off for warming up. And if somebody's giving a speech from the stage, we put our masks back on. If we have a movement tacit, we have our masks on. Generally, if we've got, I wouldn't say if you have 15 seconds of rest, the mask doesn't come back on. But if you have 4 or 5 minutes of rest, most of us, when I look around, most of us are being very disciplined. We just have this extra layer, this extra habit. And there are going to be people who observe, wait a minute, this is a fully vaccinated orchestra who are getting tested and all these, why would you bother? And the reason that we bother is, as you say, Swiss cheese. Every step that we take adds 2 or 3 or 5 or 7% level of potential protection.
Excellent. And Lauren, I'm just looking at one of the questions about in what document did you discover the change in mandate barriers and mask rules? So in the province of Ontario, that information is found in the Ontario regulation, which even if you Google Ontario regulation, third step and exit, that's where that can be found. But of course, as Meiko described earlier, it doesn't say, now you don't need to have a barrier. It removed some of those sections and replaced them there's a section called live entertainment, and that's where it says that you must have a barrier if you cannot maintain 2 meters between, at least 2 meters between your performers and your spectators. The mask rules are, for the most part, within the general compliance section. So yeah, wherever there is guidance, that's helpful, but ultimately the requirements are in actual government regulation. And then we talked about, I'm just looking at the one about, I'm asking for wind distancing for wind and brass. We talked about that. Oh, look at that. Catherine already posted the link to step 3 regulation. And she has even posted the information about the barriers in live entertainment, screening. Are there any more questions that I may have missed, Lauren?
I think that's everything that's coming through the chat. So
Okay.
if folks, you have any more questions, be sure to get them in now. But yeah, if anybody has any last words before we wrap up.
And questions are great, but I would also be interested in hearing comments. So if you're, listening to this and you have some really incredible thing that you've been doing with your own orchestra, I think we'd all be interested in hearing that. If I'm not sure how you would want to deal with that, Lauren, maybe just have someone pop their name into the chat and you could call on them to join in, or any feedback, like, is this information, have you learned something that maybe you can apply in your own situation?
Yeah, if anybody wants to paste in the chat, we'll keep a record of it, and we can share that after.
Yes, Chris.
I'm wondering, is Chris Walroth from the Toronto Symphony still on the line? If he is, if he could clarify that the information we gave about the rapid testing for the Toronto Symphony, that the information we gave is current, and perhaps update us. He may not still be on the line, I'm not sure. Oh, he's there.
Chris, you should have the ability to turn on your audio if you're comfortable.
Hi, yeah, if you can hear me, this is the first week we have gathered the orchestra. So, and we have implemented rapid testing. Every member of the orchestra is being issued with 25 of the Abbott tests, and members of staff who are in very close contact with the orchestra are being offered the opportunity to do the same home rapid testing. We're also requiring fully vaccinated status. So yes, the information you shared is correct.
Excellent. Thank you, Chris.
And just one more came in from Janice. She says, could you speak to the details of your pre-screening procedure? And I see Catherine's link to the Ontario document, but anything at NACO in particular?
I think if Catherine, if one of you can share that generic Ontario government employee COVID test, that's what we're using right now, and it's a very quick list.
We have a QR code posted backstage for our musicians, for anyone who arrives and who's forgotten to do their pre-screening ahead of time. We have the QR code there, which a lot of people have found very useful. And the link on the Ontario website that Catherine has shared, it's a really fast and easy screening tool. And once you complete it, you just email your results to, we have a special email address at the NAC that everyone is emailing that to, instead of emailing it to me, which they did last year. So
I see on the chat a question from Dennis Tang about singers similar to the one for wind and brass. Yes, basically, if you're on the stage and you speak or open your mouth, you need, and you don't want to have a mask on, you need to participate in the screening.
Yeah, we just worked with a reggae band with a singer. There were a couple of vocalists on stage for the student matinee recording we did this week, and all of the the band members and the singers went through the shoppers rapid testing program that we have set up, and it worked very well. So they had their masks off whenever they were on stage.
I've also done some work with, sorry, go ahead,
also,
Chris.
Because they've come into the building, they are all fully vaccinated as well.
Right, good. I've done some work with a couple of choirs, and there was actually a really great webinar from BC Choral Federation, I believe it was, where they gave, there were several people who lead choirs who gave some very, very extensive and fascinating updates on how they were managing their choirs. Some of the folks I've talked to have implemented singers' masks, which are specifically designed to make it more easy to sing and to get a breath. So they've had some success with that. Clearly, that may be something that's more relevant in the community choir world rather than the professional choirs, but I think they're also in use with some professional choirs. There it is. Lauren's posted the webinar. I encourage you, if you're dealing with singers, to have a look at that because it's got some great info.
Yeah, and we have this employers program through the Shoppers Drug Mart, but it does require, we have a special code and a special website, and you have to pre-book your appointment. And we've had some artists, arrive and they haven't gone through those steps, but they wanted to take their mask off, and we just sent them to the closest Shoppers Drug Mart, and all of their locations are offering this as walk-up right now. It costs $40 for a test, so there is that option kind of widely available now.
Good. Do either of you have any sort of final wrap-up words of wisdom? I know we've got you all talked out. What could we possibly say? I'm going to ask Chris. Chris, do you have one pithy comment you'd like to leave our friends with?
Not pithy, maybe sappy. Would sappy be
Sappy's
okay?
good. Bring on the sappy.
At the very beginning of this seminar, you alluded to the importance of cooperation between performers and staff. And our reopening committee has acted as one in every way. And it's been at the core of the sense of shared mission and shared responsibility. And those of you who have not met Meiko before will see in the last hour and a half how empathetic and intelligent her work has been. And I hope all of you are blessed with having administration of this level of competence and character.
Thank you, Chris. That's very nice.
Oh, now you're going to make it cry.
I'm going to say something sentimental in the same vein. Chris I feel so lucky to have someone like Chris in the NAC Orchestra, and to have been able to work with him so closely, as well as the other musicians who've been on our committee. It's been amazing, and the amount of work and dedication to all of this that Chris and the others have shown. And yeah, we absolutely have felt like one team through all of this, and I just feel really, really lucky. So that's my closing statement.
Excellent.
Thank you, Chris.
Let's pass it back to Catherine, and I'll just say this is a tremendous opportunity for me to talk to both of you, and I'm really grateful for that. Thank you.
Thank you, Janet. It's been great.
I think all I want to say is wow. Anyone who is an audience member for the National Arts Centre Orchestra is well aware of the artistry that the members of the orchestra bring to their work. I think we can all deeply appreciate the level of administrative and production support to help create the atmosphere within which that art is made. Meiko, I want all the donuts in the world for you. If you want donuts for Meiko. Christopher, I wish you great joy in all of your reads. May your thumbs remain supple in the months to come, and your care and your artistry are manifest in this and every note I've ever heard you emit. So deep gratitude to you, And Janet, I think of you as the goddess of performing arts, health, and safety. Again, I think we all feel very fortunate to have you as a friend, advisor, colleague, and expert on demand. And again, deep gratitude to you from all. So, to everyone who's here today, we will be sending out resources from this session and making the recording of the session available, également en français. And so I'll also thank Paul Stiles, who is doing the simultaneous interpretation today. Thank you, Paul. Thank you to my mother, who is accompanying these parting words on her French horn, a floor below me in my house in Peterborough, if you're wondering what that beauteous sound is. And thanks to all. If you are your organization's representative in the membership of Orchestras Canada, just a quick reminder that our annual general meeting is taking place next Wednesday, the 29th of September at 1 p.m. I'm not just asking you to attend because we need to get quorum, although I believe we're close, but also because it's an opportunity to gather, to learn together, and this year, remarkably, to celebrate the announcement of the winner of the 2021 Orchestras Canada Betty Webster Award, something else we're quite thrilled about. Don't forget to fill out the post-event survey, and we look forward to staying in touch with all of you in the months to come as we continue to figure this out together. Thank you all, and kudos to our team of star presenters. Thanks so much for your generosity and your insights. Thanks, everyone. Have a great day. Bye-bye.
Thank you.